right, well, my name is Eric Lukoff. I'm founding Chief Technology Officer of One Degree, which is a nonprofit that's actually a part of a nonprofit Illuma now, and I'll talk more about us in a second. I've just been designated as the first of the 4 case studies to introduce the session and the panelists, so thanks for joining us. And I'm joined here by my colleague Marina Alvarez from the Los Angeles County Department of Health Services. So why don't we get started, and you can go to the next slide, Stephanie. Great, you're all here. Hopefully you've all come to the right session, and we're excited to share these stories with you about 4 different ways in which folks in county and public-private partnerships help to innovate during the pandemic and reach people and solve some really urgent issues during the crisis. Great. So Marina and I will be talking about our case study, which is a real-time COVID-19 testing availability application that we co-developed and launched really rapidly to solve an urgent crisis that the county faced and residents in the county. And we'll start by introducing ourselves, and then we'll dive into what happened, and then we can talk about the solution that we came up with and some of the impact that we've had. And I think you can just add your questions to the Q&A on the right side here, or you can chat in the chat box, and I'll try to respond to you. There's going to be Q&A at the end, but we're going to go through our sessions pretty quickly. You can go to the next slide, Stephanie. So I'm Eric Lukoff. There's a picture of me, but I'm also live. And once again, I co-founded and led One Degree, which is now part of nonprofit Illuma. I'm our founding Chief Technology Officer and also was our Chief Operating Officer for several years. Before that, I was at other social good organizations like Change.org and helped to launch Vote.org and scale the technology platforms of both organizations, and also worked on political campaigns and have a formal background in software development, as well as working on electoral politics and other nonprofit work. Next slide. Marina, do you want to introduce yourself?
Sure. And hi, my name is Marina, and there I am. Still the same person. My hair is a little bit longer thanks to COVID. And keeping at home, right? Well, for the past year, since the beginning of the pandemic, I've been part of the LA County Department of Health Services pandemic response efforts. And for the past year, I've actually been the operational lead for our community testing in the county of LA. That's about overseeing 200 testing sites in the community. Alongside Eric since the summer, and really excited to be here to provide you information on how we came to address the need in the community and how to get testing available to our residents in real time, but really dealing with the insurmountable task of having tests first available and then getting into the right individuals. So more to come on that.
Great. You know, the next slide. So we want to walk through this, and this will primarily be our visual here, but you can feel free to take a look at the product that is still live and being used across the county at testing.onedegree.org, the number 1degree.org, or also you can go to covid19.lacounty.gov/testing, I think it is, and you can see the product embedded there as well. And so we're going to talk through how that came about. So first of all, some background. Actually, Marina, why don't you take it back and talk more about the landscape and what was happening in the county back in early summer last year?
Well, prior to the summer, let's take a couple of months prior to that. As we all know, the emergency declaration was started, at least for LA County, in March. We actively engaged our city partner, our settings to get testing. And at that time, as you all recall, if you were working in the field, the test for the community, and there was a lot of misinformation of where you can get it, who was eligible, if testing was meant for everybody. In that time, from March to June, county did create a website, which is the COVID testing /test COVID-19 LA County. We should probably put that on the chat so everybody can go visit that website after this presentation. But we'd had a static page And we did our best placing all the testing that was available at the time. And what became a static page also and telephone calls from the public asking more information. Where can they get their tests? So we did at that point create a map where we pinpointed these locations. And again, those emails and those calls never subsided. So finally, this is where our mighty Eric comes into the picture, riding the white horse to save us on how to make a platform that was, one, accessible. It was provided time-sensitive information, such as the hours of operation, if a site had availability, if we have testing sites with language, and also different varieties of filters that really were meeting the needs of the community. And that one of our biggest concern is, are we really meeting the needs in the community with the new help, that was providing from sites and different entities from the state, city, county, and federally qualified clinics offering testing. We really wanted to become a centralized location for our county residents. You can imagine LA County is over 10 million residents. Those emails and questions answered, hopefully, the website is what we were trying to get. And that's where, Eric, you come in.
Yeah.
As a navigate.
Yeah, thanks for that background. Yeah, thanks for that background. I think it's helpful context for everyone. And and more background about our partnership with LA County. So 1 Degree, again, now part of Illuma, helps poor, low-income, no-income individuals access social services like food, housing, shelter, job training, childcare, as well as public benefits like SNAP and Medicaid. And we had been working with the county for many years. So Los Angeles County Department of Health Services actually brought 1 Degree at its core platform, which helps people find those resources, to the county back in 2016 as part of its whole person care initiative. And the goal of that partnership has been to help residents address their social determinants of health. So things like those resources that directly affect the health and well-being of them and their families. And so it was because of this close partnership that Marina's team reached out to us in early summer last year when they were facing the challenges that Marina just described, to really help address this really specific problem facing the county with getting residents to COVID-19 testing rapidly. And what we were able to do was leverage our existing partnership and the existing trust that we already had, because we had worked together so closely for many years, to say, yes, we think we can do something for you, and if give us this opportunity, we'll help to try to solve the solution pretty quickly. And so we were able to use 1 Degree's existing technology platform, which includes a search engine that already geolocates resources and makes it really easy to put resources on a map and help people find them, what's closest to them, and it already has tools for managers at organizations to update their resource information and availability and times. And so we were able to take what already existed and repurpose it and create essentially a new front end for our platform. And we were able to support basically a new data model in COVID-19 testing sites very quickly because of this existing infrastructure. And so within just 3 weeks, we were able to put up a proof of concept, go back and forth between our team and Marina and her team, and we were able to just figure out what were the highest priority things that needed to be available from day one once it was launched. What are the things that we could deprioritize but still we think are important, and decided to get it out the door as quickly as possible. That was the priority, to really ensure that we were helping people access testing as quickly as possible. And I'll say that I think overall, there was obviously, like every product development process, there's always a long list of things that we want to develop and get out the door, and we lots of additional filters or features or ideas that we had that we thought would make it better. And what we did was we paused on sort of the bells and whistles and just got what we could as quickly as possible as a minimum viable product. And we were able to then prioritize based on what we were actually hearing from the community once it was launched. And we listened to feedback. Marina, maybe you could share some of the rapid changes that we made all summer long, and then through the fall, and even through the winter, and through the spring so far. We're still making changes. We were also dealing with the rapid needing to scale up the service and then back down as the actual conditions change for the volume of people needing to access testing changed dramatically in November, December, and January in LA County. Marina, anything you want to add on that?
And actually, just to piggyback on what you mentioned, I think one of the things that worked in our partnership of having a county or government and private is the close relationship that is mentioned by Eric. We launched in 3 weeks, which to me was a huge endeavor because we at that point I had, I believe, about over 125 testing sites in LA County, and having them on a website in 3 weeks to us was amazing and well received by the public. They had finally a place they can go to get what they needed and the type of test that they wanted. If it was a walk-up, because of the website, we were able to filter walk-up. If it was a drive-up, they knew they can go to a car. If it was an oral or a nasal test, those were important questions that residents were asking. And so we were able to provide those informations and also support the media increase. So we were able to pivot and use that website, which is already I've included in the chat, to really get the answers to our residents. And the other thing is what we realize is during the summer times, we had I would say a mild surge compared to that of the holidays of November to January. So at that point, when we launched our website is when we saw a peak of folks going to our website. And that peak blew up in November, December, when we had the surge. And I think this occurred throughout the state. And one thing that for us, as in partnership with working with 1 Degree, was having that ability to seriously call at 1 o'clock in the morning and work out kinks, work out when we had a crash, because there was over 4 million residents on our website at the same time, and being able to, within less than 3 hours, have a website back and pivoting to being available to the community. I think that was, for our perspective, was because we are the largest county and with so many residents looking for the test, it was important for us to have that type of ability to connect with 1 Degree. And I think that partnership, that trust of understanding the magnitude of the crisis and the pandemic, and understanding that what we posted on our website was being actually viewed. It wasn't just a static page. It was actually being consumed by our residents.
Thanks, Marina. I think that paints a really clear picture. And there's all kinds of details that we could go into, but actually I think I'm just looking at the time and we should probably move on to the next panel. But I did want to just lastly touch on some of the outcomes from the work that we did, some of the quantitative outcomes. So you can go to the next slide, Stephanie. So as Marina said, there were over 200 different testing sites around the county at any given time. That has gone up and down throughout the last year. But the other thing that we want to make really clear is that it wasn't just sort of Marina and I running the website. It was actually dozens of people around the county who were running their own testing sites and keeping availability up to date on the tools that we built. And we're able to leverage the 1 Degree platform to do that. So this was really a community-based effort as well as a county and a 1 Degree effort to ensure that this was something that everyone had control over the availability of their own testing site, so that they could manage it themselves. And so that was, I think, a really big win from this project, and really critical to get community buy-in, so that they could feel confident that they could be involved in this project without being on the hook for something maybe that they didn't want to advertise. If they were overwhelmed, that they could turn it off. When they had availability, they could turn it back on and advertise that they had availability, and residents could come to them. So that was really important. It continues to be. And then you can see the outcomes here. Over 4.2 million people have used the service already. About 7 million searches have been conducted for testing, with about 871,000 searches on average every month, with obviously some major outlier months, like in December and January, when we had surges of millions of people searching for testing. And it's one of those things where I'm really proud of the work that we did together, but also I am looking forward to dismantling the website as soon as we can, because that'll mean that the crisis is over. And I think that we're all looking forward to that. So really happy we could do this and be available in a crisis. And I think we've learned a lot of lessons about what's possible. Anything else to add, Marina?
I think you did it well. I think it's what's possible. It's what we've set our minds to it, and we made something seriously without knowing how to address the pandemic, and we made things possible. What seemed impossible was really just putting our minds together. And as you mentioned, I want to definitely put a shout out that it was an effort. It's a collective effort from all the individuals who have access to their testing sites. I think that's important, is having the buy-in from our partners beyond the team of 1 Degree and the Department of Health Services to support the mission.
Great. And we'll be available for Q&A at the end as well.
Hi, everyone. I am Janelle Schaefer, and I'm joined by my colleagues Stephanie Kane and Karen Liu today. We're all members of the Colorado Digital Service. Today, we're going to share some of our work in the pandemic response space and how the power of cross-functional teams, including procurement, UX, and product, drove forward technology that met the needs of some of our public health partners and our broader members of the Colorado community. When procurement is mentioned in the public sector, it often has the effect of invoking dread. More often than not, folks associate it with bottlenecks and painful bureaucratic processes. Throughout the last year, our team had the opportunity to make response engagements where we redefined public sector procurement and its perceived value. Our approach to this space is centered on treating procurement and contract management as a partner and as a strategy discipline. The activity of buying and selling goods and services is inherently one that's foundation is need. Rather than treating procurement as an obstacle to be overcome, we treat it as the vehicle that gets someone where they need to go. The typical approach for technology procurements puts UX and product squarely after the procurement has already occurred. Incorporating UX and product upstream into competitive procurement processes has been a tactic our team has deployed throughout the pandemic, because we believe that it strengthens the resulting vendor partnerships and it ties solution development to end user needs early and often. Doing this means we transition from procurement as a transactional process to procurement as a partner. There are so many options with existing procurement within existing procurement regulation if we just think creatively and meet people where they're at. We should be using cross-functional practices throughout our entire journey of delivering technology in the public sector. Our approach puts solving problems, iterative improvement, and relationship building first. This speeds up delivery without sacrificing value, something that has become really essential and important in pandemic response. People often ask our team what magic trick or hack we are using to get around procurement restrictions. At best, folks think we've found a loophole. At worst, they assume we just break all the rules. It's really important to clarify that we actually aren't breaking any rules. We're just changing the established processes within those rules. And for example, instead of a demo of a SaaS solution with vendors, why doesn't the public sector do workshops to assess culture and methodology fit of a potential partner? Why can't end user exercises be integrated into an evaluation rubric for an RFP? It isn't the legislation blocking these efforts, it's the perception of the process and the historical precedence of doing what we've always done without any question. So I want to turn to our particular case and how we're using this framework there, or used it. In July, we were approached by the Department of Public Health to review a contract draft to procure a case investigation and contact tracing system the day before the contract was due for signature. Case investigation and contact tracing are not new to public health. However, counties were using a patchwork of systems that led to data being entered 2 or 3 times. It lacked consistent data standards and made cross-jurisdictional case management incredibly cumbersome, if not impossible. So at the height of the pandemic, and in the face of case investigators being unable to respond to surging caseloads with more than Excel spreadsheets and pen and paper, public health was given a free pass to just award any vendor of their choosing in order to buy this technology. To choose the solution, the agency had watched 10 demos quickly, asked for vendors to check off in a bunch of boxes whether they met some requirements. And so although the public health department was nervous, they were ready to pull the trigger based on that exercise. And doing so, that system that they were going to buy would have to support 53 diverse local public health authorities with thousands of users across Colorado. As we entered that room that day to review the contract in just a 24-hour window and give some feedback, our team took a risk and asked the question, will the system actually get your end users what they need? When the answer from the state public health department was a resounding, "We don't know," we kind of proposed a different path. What if we used a competitive procurement process as the vehicle to determine the problem we were trying to solve and what role technology should play in it? Now, let's remember, we didn't actually have to do a competitive procurement process here. And to be honest, at first, when we suggested it to our partners, and that they opt in to doing competitive procurement, they thought we were crazy. The turning point, though, was demonstrating to them that what we were proposing wasn't what they were used to when it comes to procurement. Our methods would put their needs at the heart of discovery and evaluation of vendor offerings. We championed the concept of procurement as a strategic partner rather than procurement as a transactional pass-through. In the evaluation exercises we conducted throughout the entire competition and put interdisciplinary and cross-functional thinking at the forefront. Through this vendor bake-off that we did, we incorporated exercises that tested and evaluated live systems both from UX and from a technical perspective. We ran workshops with the vendors, provided feedback, and gauged partner fit based on how they responded. We also ran in parallel contract review and negotiation processes with all the vendors so that when we actually selected who our ultimate partner was, that part of the process was done. I'm now going to hand it off to my colleague Stephanie Kane to talk a little bit more about some of these incorporations and what they look like.
Thanks, Janelle. So as you can tell by now, our team has a theory of change and that procurement and user research are long lost best friends. And like she mentioned earlier, procurement is the art of getting what you need, but user research is the art of understanding what you need. When those two disciplines are paired together, they create the foundation for buying and building technology that best supports the people that will ultimately be impacted by that project. During the vendor bake-off, we tested this theory by applying human-centered design practices to the evaluation of contact tracing systems. We began by conducting generative research to learn about the current state of contact tracing across the state and to identify opportunities for technology to improve efficiency and collaboration. And sometimes when you're buying and building technology in government or in other spaces, a team will feel really pressured to define everything upfront in order to reduce the chance for changes to contracts later on. However, we believe that continuous change is good, and it's actually a critical factor to building technology that works for the people who use it. Our goal was not to be perfect up front, but to define a good place to start and allow for the adjustments to be made over time as we learned so that the system could grow to meet the needs of public health and the people they serve. So rather than asking a few key stakeholders to generate a long list of feature requirements, we enlisted actual users to help generate a list of user stories to communicate the outcomes that the system should help people accomplish. We reinforced that there would be many opportunities to adjust priorities and needs as we learn from people using the system. And then rather than asking vendors to present decks and demos to our stakeholders, we asked for live systems so that we could evaluate through usability testing. In order to attract the right vendor partner, we believe that it is important to give valuable context about the people, process, and environment that will surround that piece of technology. And one artifact of our generative research was a service blueprint that described the end-to-end process of contact tracing, including internal and external steps along the way. Before the bake-off began, we shared the service blueprint along with user stories so that vendors could respond directly to Colorado's needs. Not only did the user stories help to provide context, but we also used them to drive our scripts during usability testing. So after 2 weeks and 40 plus usability tests across local public health agencies and state employees, we had the information we needed in order to pick the best tool for public health. Because everyone was moving so quickly to respond to the pandemic, the speed in which we could launch the tool was an important factor. After the usability tests, we had strong assumptions about how much configuration each tool would need in order to meet our needs. One of the tools had been built by public health professionals, and though there were many usability issues around that tool, it felt much more familiar to users during usability testing. We felt that it would be the fastest route to working software. I'm going to end my section and pass off to Karen on this quote, which is from one of our friends of the team, Waldo. It's never too early to engage users in a project. And like Waldo said, it's forehead smackingly obvious to move it up. And with that, I'll pass to Karen.
Thanks. I love that quote. Okay, so with this reframing, the partnership there does not end with UX. So I served as the product manager on this and would not have succeeded without Janelle's role in ongoing active vendor management. Coming from the private sector, I really value cross-functional teams, but I never would have thought a procurement and contract specialist would be such a core part of a product team. But here in government, it's been an absolutely vital partnership for the success of our efforts. All right, let's talk about what it looks like when we add in product. And by that, I'll reiterate, it's really to shift to a product mindset that really matters at the end of the day. So Sid has this definition of product that we think is so lovely in this context. I really like it because it doesn't mention technology anywhere. It really focuses on users and on our responsibility to serve them. So when our team works, it's always about the people first. We have learned that focusing on people and relationships is the foundational layer for literally anything else to work. And that's where Janelle's role in the product team was so key, not just helping us find the right vendor, but then translating strong relationships into effective, active vendor management throughout the process to this day. So thanks to the amazing UX research done during the bake-off phase, we already had a great idea of what the MVP needed to be and had solid user stories in hand. So from there, we were able to get into a really good sprint cadence with our vendor. Our prioritization was always informed by ongoing user research and user engagement. This was especially important during COVID because things changed so fast. At one point it was new CDC guidelines. At another point, due to the surge, we had to drop everything and focus on new features for search support. So we made sure through research that we were building the right things quickly and had that flexibility to deprioritize everything else if we needed to. So to date in Colorado, we have had hundreds of thousands of cases investigated and contacts notified of exposure. There have been some really key integrations with other state systems. And most importantly, the bigger product vision was always that this would not be another one-off system. It was always envisioned as something that could grow and support more than COVID and expand to other communicable diseases and be a valuable public health tool for the long run. All in all, from bake-off to us onboarding all of the local public health agencies, it took about 113 days. Had we gone the traditional RFP route, it would have taken 6 months to even choose a vendor. So approaching it this way really enabled us to work strategically, but also to get to work fast right out the gate. We knew we had that solid foundation in place. We knew we were going to iterate quickly. So as Steph mentioned, there wasn't the pressure of getting it perfectly from the start. So I want to emphasize that this is still a living and breathing thing, both in terms of the platform and the partnership. We've done several more iterations on the contract since all of this, and it continues to be something we evolve to meet public health needs. We wanted to share this nice vendor testimonial comparing the experience of working with our Colorado team versus their more traditional government partners. So this really speaks to our philosophy of partnership, of openness and transparency, of constant feedback and iteration. Again, that's a mindset that's not very prevalent in government. And our greatest hope was to show by example that it is very possible. And in that respect, we succeeded. The public health department here in Colorado now includes product managers and UX folks for the first time ever. All right, that's it from our Colorado team. If you have any questions or would like to talk further about our case study, we're super happy to connect. Please feel free to follow up with us directly. Thanks for listening.
Hi, everyone. My name is Diamond James. I'm the Civic Design Lead on Mayor Eric Garcetti's innovation team in the city of Los Angeles. So today I'm just going to speak about designing as a tool to reduce or for harm reduction to help residents make public health choices better. Next slide. So the pandemic has left residents and all of us in a constant state of questioning our everyday moves and decisions. Questions about how to best care for ourselves and our loved ones, how to have some semblance of wellness during an economic crisis and repeated racial injustices. So also for many, these questions lead them to life-changing decisions about survival that are ever present. Next slide. So as you see here, I've decided to include the two maps from the New York Times to simply illustrate just the disparities of mandates on masks in businesses. And this was from actually last week. So you can imagine or actually remember kind of the confusion and disunity that was across the country 15 months ago. Next slide. So as we have all kinds of mandates that are dissimilar across different states, also at the county level or at the hyperlocal at the city level, we knew that there were going to be challenges, and the LAI team here in the city of LA, we wanted to make sure we intervened in two ways. So one way was really helping residents to know which requirements and expectations they should have, and really helping them to do that better. So the grammar here is a little bit unorthodox, but I want it to be clear that these two projects I'm going to share are not really about helping to dictate which choices people should make, but helping to give them that decision-making agency much better than they had before. So the first project is going to be about the citywide signage efforts that we did to help our 50,000 employees and 4 million residents navigate city facilities. And also making sure we created an informational architecture to better translate the public health orders to laypersons. Next slide. So the first project I'm super excited about is the multilingual citywide signage. So there were 5 challenges as we approached this project. So employees and non-employees frequent city facilities. Even though many were closed, we still do have quite a bit of pay counters for people to pay bills and various things to keep services ongoing. Several departments have begun requesting COVID-19 signs to prevent the virus spread. One memo was released to provide general guidance on signage, and also signs differed in wording, visual styles, and lacked behaviorally informed language. And then that meant that the demand for custom signs was going to create a bottleneck for our general services department who makes the signs. Next slide. So as an intervention here, I was very excited to help our general services department create a 99 sign inventory. So we're just short of 100, but that's okay because the signs were accessible in 9 languages, including Spanish, all the way to both Korean languages and Persian and Russian, as well as English. In addition to the actual sign inventory, I was able to create 3 catalogs reflecting those languages. And also, this was accompanied by a new ordering process and a revised order form to help streamline the ordering process for departments. I also hosted a webinar for the safety officers to be able to know which signs would be coming their way soon. Next slide. So as I mentioned before, many signs, as you can probably recall from your own neighborhoods or cities, just kind of generally mention wear a mask, and it's just kind of very baseline guidance on the mandates, but are not informed by what actual behaviors they do want to see versus just what is prohibited. So here you see just a general diagram of an office lobby that we may have across the city. So we made sure that when I designed the signs, they were informed by patterns of how a user would interact or behaviors they would take within a space. So making sure wording and signs were created for entrances as well as elevators, or actions to take after you are touching parking pay kiosks and things like that. So next slide. On this slide, as it loads, you'll see just 3 examples of this behaviorally informed language. So I'm particularly excited about the middle slide, which is check yourself. So it's really a play on words in the English language we had, but it really is to invite you to do a self-assessment. And this was featured outside of the building. So it doesn't make any sense to say, wear your mask inside if you already went inside not wearing a mask. So we really wanted to make sure that people had the chance to kind of literally check themselves out. Were they feeling well? Were they going to be willing to keep their distance? And were they actually wearing their mask versus, leaving it in the car or on the bus or something like that. Also on the left and right of the middle, you'll see the hand washing sign, which was which was printed and posted at our pay stations for just to remind guests to wash their hands after using, the PIN pad after making transactions. We also have a sign about high touch items, which departments may have ordered to place near copy machines or, kitchen microwave if a certain number of staff were still in the office. So next slide. So here are two more examples of signs, just showing the general guidance of our public health. I call it our sign that was most public facing and ordered for people to just kind of have the basic lay of the land. This sign is particularly interesting because it does feature language that we want of behaviors that we want people to take, such as, instead of no contact people, we use language, use waves or head nods to express what behaviors were allowed instead of just what wasn't permitted. On the right, you'll see a sign that we made about the 7 basic symptoms, and we made it in Korean this could be used at our libraries or where people frequent senior centers and things like that to get kind of congregate meals that we were still offering. Next slide. So here's just a diagram that is of one of the pages of the catalog. I included some key features that would be helpful for departments to know how to order quickly and easily. So I created a whole system of categorization with initials of new sign codes, placement ideas, just sharing where they should put them, the actual design of the sign, and then a recommendations table showing the sizing preferences or sizing availability, and also the materials that they might consider depending on facility. Next slide. So I'm really happy to report that we learned that as of March, we made a total of 62,372 signs and floor graphics that were ordered by 31 departments across the city and council offices. So as you see from that, LA is very large. So it was really quite an honor to make sure we had this guidance throughout the city. So I'll go into the next, you can go on to the next slide, and I'll just quickly go through our second example. So in order to make sure that we were giving residents a chance to learn information as public health information changed abruptly, we decided to create the What's Open webpage on our Safer LA brand that we've been using through the pandemic. So this would detail and help solve the problem of residents not knowing the fluctuations in service changes or businesses and schools, and also solve the challenge of difficult orders to read without agency or institutional knowledge. Next. So this is to demonstrate the information translation that the I team was having to do. As the city does not have its own public health office, we are very, very much grateful for LA County, who makes the orders, and then the city will write an order to align with that. And then we were translating it all to a PDF that was not quite accessible to residents. Next slide. We also had a gap in connecting that information for residents with an existing web page that we had that was available for business owners to learn about checklists to safely reopen. So here's just a wireframe I made, which we have actually pretty much kept in place, but it would list, and it does list, the state tier order info that we're in, local orders, and just baseline expectations, so people can again know the choices they can make safely. And also this resident info using this green, yellow, and red system that we've all pretty much become familiar with, as well as the tools we already had for businesses. Next. So thank you. So a key feature of this, and I'll go quickly, is just the green, yellow, and red icons, as we're familiar with. Green to indicate which businesses are allowed to operate, just full expectations as a business would, generally exactly the same as before the pandemic. Yellow to indicate that the services and the goods you can receive are the same, but the way you might get them is slightly different, such as curbsides or outdoor haircuts. And then what is closed and restricted to the public. Next slide. So quickly, the process design, we use Google Docs as the text base. So when we get an order, the I team has a couple editors who are able to always update this main document. And then it also helps us have democratize this work to make sure we're very accurate and can keep pace as orders change. Next. So in the final implementation of this website, which is still active, we're still updating to our yellow tier, is that we did not end up doing kind of the accordion where residents could click, but it is one long scroll, which actually helped with speed of delivery and also making sure that we can be as accurate and get that information to residents. Next. So just quickly, the 4 takeaways is that a small team can publish useful online content and conserve resources. We did not hire developers to do this, and our team aren't web developers, but we use existing software to make it happen. And then the current page architecture does offer flexibility and fast response to keep pace as those orders change. And then also the Safe for LA directory does ensure that residents do have a home base to learn which choices they can make and then execute the choices that they are choosing in a safe manner. So this is really, both projects were really aligned with the I-Team's principle on design to make sure city services and information is accessible and that we're helping to keep residents safe and prevent illness and the spread of the virus as they go about making those decisions every day. Thank you.
Great. Well, thanks so much for that. I'm Sue Speakman Gomez. I'm with Housing Link, and joining me today is Casey Helbling with Software for Good. We can go ahead to the next slide, jump right in. Housing Link is a non-profit based in Minneapolis, Minnesota, and we have spent our career focusing on increasing racial equity in housing through housing choice and access to housing options for folks. Annually, we have about 1.3 million searches through our normal website that we operate on a day-to-day basis. And we also streamline hundreds of subsidized programs into a simplified search and help both renters and policymakers the landscape of affordable housing in Minnesota to support struggling renters in our states. We had a unique partnership with Software for Good that led us into being able to work in the COVID space. Casey, say a little bit about them.
Hey everyone, thanks for having us. My name is Casey Helbling. I'm the founder CEO of Software for Good. We're a public benefit corporation out of Minneapolis, and we've been around for about 17 years now. We design and build web and mobile products with client partners who are trying to make the world a better place through technology. We believe that tech, when designed and deployed properly, can be a force for good. We've had the opportunity and privilege to work with Sue and the Housing Link and the Housing Hub platform for about the last 5 years now. Slide.
Great. And we know all too well that housing is critical to help keep people safe and stabilized and rooted in all of their needs, whether it's their kids going to school, getting to work on time, and staying safe. You can go ahead to the next slide. One thing that we realized as the pandemic started happening was that in Minnesota, there was no central place for people to access housing cash assistance to help with housing other than through traditional economic assistance programs. And so with the CARES Act and that influx of money coming, we were in conversation with the state trying to figure out how are we going to help all of the folks that we know that are struggling. Our core base is in working with renters, and we knew that about 30% of the renters in the state were struggling to meet their rent obligations on a daily basis. And on top of that, there was another 10 to 15% of homeowners who weren't able to meet their housing payments as well. Next slide. So we had already been working on what would help solve the issue, and that was our Housing Hub platform. This project was created because renters couldn't see where they were at on affordable housing waiting lists, and properties couldn't find renters when they had a unit available and they were ready to rent to them. So we had approached Software for Good and said, you know, we want to create something that's open, transparent software that helps to solve this problem for low-income renters in Minnesota. And Casey and his team stepped and helped create this Housing Hub platform.
Yeah, exactly. And we spent a lot of time doing research up front. We did a bunch of interviews. And we learned just how fragmented, confusing, and demoralizing the existing waitlist process was. People are just trying to find a place to live. So we ultimately had a goal of streamlining and simplifying the application process to give people the peace of mind and ultimately hope to find that place. We also had a property manager side, and the goal on that side was to manage the complexities that were matching the applicants and the waitlist. They're like literally thousands of applications connecting with thousands of property managers and waitlists. And on top of that, there were all the federal and state requirements that we needed to build for. We needed to ensure that the platform was secure, that it was auditable, it was scalable, and that it was efficient, because we knew that ultimately if we built something that wasn't easy to use and didn't make property managers' lives simpler, they just weren't going to use it. So we ended up building a mobile-first React applicant application. That was on top of a Rails API backend. It was containerized and deployed to AWS. And then on the administrative, the property manager side, it was a Rails monolith utilizing the administrate gem and a couple other things. So needless to say, we had done a bunch of research, had a solid foundation technically in place when we started this conversation about what we can do for the state in a really quick turn.
So we can go ahead to the next. And, you know, I was in conversation with the state about these CARES Act fundings coming in, and they were talking about how there's a really fast timeline. How are we going to do something that will help solve this issue for Minnesotans? And I thought to myself, well, we already have a great platform that does a lot of what they need. So I called Casey and I said, am I crazy? Is this possible? To his credit, he was willing to step in and said, I don't know, I think it is. And we jumped at the opportunity to partner with the state on this and tackle this work. And so we can go ahead and move into the next slide. We were able to build on a few key things. The first one was trust, not only trust between Software for Good and Housing Link and our existing relationship. And Housing Link has a long history, over 20 years working with the state of Minnesota. But more importantly, we have the trust of renters, nonprofits, landlords, and policymakers in the community, as well as leaders in the home ownership sector who know that Housing Link, all of the work that we do and all the applications that we make available through our site are centered in human-centered design approaches and really prioritize the end user and their experience and creating as easy a process as possible, because we know if you're in a housing crisis, already stressed. And the community trusted that the solution would center the human experience and be focused on equitable access to the resources that were coming into our state.
And then building on that already established trust, the state of Minnesota came to us with a goal, with an objective. They didn't have a long list of requirements. They had some requirements, but they didn't have a laundry list of like must-have requirements. They basically said we need to build a platform that accepts applications from applicants. We need to build a property or a program administrator side that can sift through these applications and effectively figure out who to hand this money out to. They came to us, and then they trusted us and our expertise to solve the problem, and they effectively got out of the way. That y'all know that's not how this happens. Like it doesn't work like that normally, right? Like normally they come to you with this ginormous RFP with a gazillion requirements. Everything's non-negotiable. It came from legal. You got to do it. You can't say no to anything, right? So building on that trust, letting us do our job, what we've been doing for 17 years, it really allowed us to move quickly So what we did is we had this opportunity to sort of prioritize the features that were, like we said, the must-haves, the MVP, focus specifically on the applicant experience first and foremost, and make sure that that was simple and bulletproof. And then we also recognize that some of the things that were ostensibly requirements were still negotiable to sort of the extent of the requirement that they were. So for example, the state was really interested in us integrating with a third-party e-signature solution. After back and forth and discussions, we recognized that there are simpler ways that we could basically get the applicant to sign away to release their information. And we provided actually two different solutions over the course of the program. One was the applicant just effectively signed a piece of paper, took a picture of it, and uploaded it with all of the other documents that they uploaded. And then another one was a little bit later on, we just integrated a checkbox and a signatures area on one of the forms, and the state was totally happy with that as well. So anyway, we took this existing Housing Hub platform, we ripped out all of the things that weren't important and not needed. We built on sort of this existing infrastructure, scalable infrastructure. We worked constantly in a continuous integration, continuous deployment process with the product team and the stakeholders to constantly be showing and not telling the product and sort of how it was growing over time. Next.
And ultimately, we realized that, being able to meet people where they were at was the most important thing. The state of Minnesota is a huge state. We have big sections that are really rural and don't have good internet access or don't have internet at all. There's still a lot of households that just use a regular phone attached to the cord on the wall. And so we had to support those folks too, and made sure that we partnered with United Way 211 so that there was phone support so people could submit an application just over the phone and then mail in paperwork as needed, and really made sure that we didn't leave anyone out from being able to access the resources. And
from the beginning, building on the Housing Hub platform, we already had in place the ability to use SMS or email notifications to keep in contact with applicants through the process. Users could sign up with either an email address or a phone number or none at all and just work with 211. We also were very interested in building on inclusive form design. We were very cognizant about using just a full name field rather than first name, last name. We were very careful about othering with race, ethnicity, although we ended up losing a little bit of some of those battles with the state. We did do more user research and found out that the identification numbers and types in the dropdowns weren't inclusive, and we made quick changes to make them more inclusive, to incorporate tribal ID numbers. Yeah, next.
And ultimately, we met the goal. We launched literally within 21 days of signing a contract with the state. There were a few late nights and long weekends in there through the process. And on day one, we had over 50 agencies with 500 staff working in the software and thousands of applications the first day. Next slide. And that grew to over 80 program administrative partners with 900 employees processing applications and over 70,000 requests for assistance. That's about 10% of the folks in Minnesota accessing the software at some point in time. And I'm super pleased that the software never crashed. It was only down for a 2-hour period. We launched a major change to the software. And there was wide recognition among the community that the program was successful, including a shout out from Governor Walz in a video that he sent out thanking everyone on the team. So it was even though it was a recognized success though, we still, next slide.
Yeah, as you know, software is never done, right? Once you launch, that's really sort of when things start, right? And so, and using agile software development, and recognizing that, the regulations, the program design, like code restrictions, everything on the ground was entirely fluid. Things were constantly changing. So utilizing agile software development, continuous deployment, strong, robust test suite, we were able to sort of manage that risk and that change over time. We changed how we did like I said, how we did the digital signatures. We changed entirely how we did assistance requests to support applicants to apply for multiple assistances over time, because people were continuing to be hurting and there were more dollars available. So so like Sue said, there was a ginormous refactor in the middle of the platform to support this new process. And we continued to test, build, and iterate on the product that we had until the end of the program, about the end of the year, kind of beginning of this year. Next.
And finally, Minnesota solved this problem, was able to distribute all the CARES Act funds to help keep people housed. And it was a really successful partnership between our three organizations. And I think throughout all the sessions today, we have heard the themes of relationships and partnership and how critical they are. And in addition to that, I would just really, echo human-centered design and making sure that you involve that thinking in the process. And it does take time. If we didn't have Housing Hub as a base to build off of for this program, Casey and I both would have strongly advocated for additional user testing on the front end and really engaging users all the way through. So we can go to the next slide. And thanks so much. I think.
Yeah, thanks everyone.
Thanks everyone. I think all the other panelists are going to come back for questions.
I'll just quickly say, like, when I heard Eric, your presentation at the very beginning, first time I'd ever heard of it, I was like, oh my God, that's the same thing that happened to us. Like, so many themes happened, I think, probably across the country over the last year and a half. So
yeah,
it's
definitely
really awesome to hear that.
A lot of common lessons.
Mm-hmm. So do we have somebody moderating, taking questions?
So I can moderate. I mean, there's a moderation panel that showed up on my screen. So I'm not sure what will happen if I click each person. Let's see. But I know a couple of us have been answering questions in the chat. So let's see.
Maybe if anyone wants to take some of the questions and
yeah, so there's a question in the chat asking, I believe Dana asked about the signs for my project. Did the I-team have to be observing? So we didn't actually have to go in person, even though we do like to do resident research and kind of, do the friendly stalk and watch people. But we were at our homes, but it was just really me going back and forth with our facilities management staff. And then just really thinking of myself walking through our kind of grand rotunda of City Hall, where would I need kind of a checkpoint and then another touch point. So things like that. So no, we did not have to go. Trying to see if anything else was not answered by the Colorado team. Y'all had quite a couple questions on the contract. Did you see anything that jumped out?
Well, one thing I wanted to highlight was because we talked a lot about procurement, I wanted to, we didn't really get to the nitty gritty on our project, but one thing that I wanted to highlight was actually we did not have a contract or a procurement process for our partnership at first. Eventually, the county was able to line up some funding to pay for the ongoing maintenance and changes to the product, the website, and the testing locator tool. But we started on a volunteer basis because we just felt it was so urgent, and because of this longstanding partnership. And I think that's a really important lesson too. That if you work with mission-driven nonprofits, but some good organizations, some good companies too, would be willing to just step in and do the work because it's so important for the community and you share a mission. That's just not going to be the case with for-profit companies whose basically their bottom line is just to make money and land a contract. And so that's, I think, a really important lesson too from this work, that it is possible to be creative with organizations that are willing to work with you, and obviously who have the means to do so.
I love that, like, this is almost like going to be a debate on our panel. I would say, like, it's not impossible. And we did it once in this particular instance, but we've done it close to actually 10 times. And you're totally right. Like, right, a private, a private company, like, they are a profit-driven organization, but there are people within that organization that, like, are a part of it for a specific reason, which they're passionate about. So especially if you look at a design organization, is one that I can think of that we did a different project with. There are really passionate designers that care about human-centered design and delivering it to the public. And so by, by reducing private companies just saying that they can't, right, because they'll just drive after the profit, you're not getting to the opportunity there to figure out what in that relationship allows them to maximize that and pursue it, while also pursuing goals in terms of the public value or good that's being delivered. And so nonprofits are great partners. We've also worked with them. I've also worked with nonprofits that it has been awful experience.
Sure.
And so
Yeah.
there's something there that you can win either way. But I don't think it has to do with the that part of the organization being nonprofit or public or private. I think that definition actually separates us, and it stops us from working together.
We can agree to disagree on that point, but I think that I was just highlighting that we were able and willing to do it on a volunteer basis to begin with, which I think is going to be much more unusual in for-profits.
Time, but I did want to ask one question to everyone for any final thoughts. There's a question that was posted. It says, obviously, a lot of the tech was informed by policy decisions. Do you think the opposite can be true, that your tech decisions have yielded recommendations for policy changes for the future? I see Stephanie nodding, but I don't know if anyone wants to take that.
I know that our work with Minnesota Housing, our housing finance agency, their team is actually looking at how can some of their other programs bring some information online so that renters and folks in Minnesota have access to seeing where they are in the process and having more information about the assistance they're requesting just overall across our homeless prevention infrastructure. So I think, definitely there's some things that are starting to happen that if this project hadn't been successful, these conversations wouldn't be continuing.
And to piggyback on that, I think what we've all learned in this pandemic is there's not one direction. Nothing is perfect. This is the biggest pandemic and crisis. And I think when we all work collectively, anything is possible. And back to Janelle, I think you said nothing is. I think it's really having the right group of people at the table. What is possible within the scope of, this is the way we do things when it's normal, but let's all be true. We probably won't be back to normal for quite some time. So we now need to pivot to the real new normal, perhaps, and how we work together collectively.
Well, thank you so much for attending this session. And we'll see you at the rest of the events in the conference. Take care.
Thanks, everyone.
Bye-bye.
Bye.